Bladder cancer. We're going to explain how to know if you have it and what to do if you do. We have a urologist with us today. I'm Dr. Paul Zalzal.
I'm Dr. Brad Weening. Welcome to Talking with Docs. And our guest today, you guys know him,
Dr. Peter Ince.
Dr. Peter Ince, the urologist. So
And
today,
if you haven't thought about bladder cancer, you should, because it's one of the top 10 cancers that people can get.
it is very common. Number one cause of painless hematuria. Would you say that's true, Dr. Ince?
No.
Painless hematuria is...
No, don't scare people. It's actually, a lot of people will get blood in the urine, and most of the time it's from benign causes. So if you get blood, don't panic and think this is the worst thing, I have cancer, because usually it is not. However,
Yes.
it is the number one way that bladder cancer does present.
Okay.
Goes one way, but not the other.
Exactly.
So let's start at the beginning. Who gets this? Let's talk about males, females, age, that kind of stuff.
All right, most of the time, 90% is people over 50. That's usually when it presents. However, in my practice, I've actually seen people early 30s. And anytime after. And it's men are more prevalent than women by a factor of 2 or 3. But that's usually because a lot of older men now were smokers and women didn't smoke as much back then. And then that evened out later on, and now that's declining.
Okay, so smoking, one of the big risk factors.
By far the biggest risk factor in North America.
Okay, so butt out if you're smoking right now. All right, what are some of the other risk factors?
Well, anything that causes irritation to the lining of the bladder usually has to be chronic and severe. So various things like if you've had radiation, I don't want to scare people because it's not a high risk factor, but if you've had radiation to that area, so men who've had prostate cancer get radiation, and some of that radiation hits the bottom of the bladder, and that can cause bleeding. Usually it's just from benign blood vessels breaking, but that can also transform into bladder cancer.
Okay, so radiation to the area doesn't mean you have bladder cancer, but it's one of the risk factors that if you do have bleeding, then you should maybe get that checked out.
Workplace exposures with things like highly chemical dyes and things like that?
Yeah, and that's changed a lot, obviously, because of workplace safety, but a lot of factories where people are exposed to dyes and chemicals and anything that colors plastics or different substances, that if it gets absorbed in the skin can do it. And that's why even hairdressers used to get it, because the dyes in their hair, and the darker the dye, the worse the risk.
Okay, so I remember that from medical school. Hairdressers, and was it people that worked in tire factories?
I think so. I think rubber was another issue.
Okay.
And then last one, what about people that have recurrent infections?
So that can happen, but it's extremely rare. So don't think, oh, I'm getting recurrent infections, I'm going to get cancer. That's extremely rare. But we're talking infections, that are like, there's one called schistosomiasis. Have you ever heard of that?
I have easy for you to say. It's very hard to pronounce. Nice work.
And that's a parasite, actually. It's found in Africa. So don't have to worry about that.
Well, yeah.
If you're from North America.
Tell us a little bit about that, because we do have some viewers in Africa. What is it? Schistosomiasis.
Well, it's usually ingested through drinking water. So don't drink from the local rivers.
Always good advice.
It can infiltrate into all parts or many parts of the body, but it can get embedded in the lining of the bladder. And it can cause chronic inflammatory changes, and that chronic inflammation can lead to, any inflammation can lead to changes in cell mutation.
Right.
So the other thing I'll add in that's more common is people who use chronic catheters. There is a small risk that because of the constant inflammation from the catheter, that can also lead to changes. But I don't want to scare people, but that's a risk factor.
Yeah, so you mean someone that is self-catheterizing?
More people who have indwelling catheters, where it's rubbing around.
The idea with the risk factor, it doesn't mean you're going to get it, but it just means you may be at a slightly increased risk of getting it. And it can be very tiny increased risk, like catheters, or a massive increased risk, like smoking.
Exactly.
But they're all still called risk factors.
Got to put it in perspective. Smoking by far is the worst one.
And then of these risk factors, we talk about things that are modifiable and things that are not modifiable. Smoking is a modifiable risk factor. Self-catheterization for other reasons is not really modifiable.
Okay, so then let's talk about how they present and why they present that way. So painless hematuria, we talked about this.
Yeah, so people show up to their doc, say, listen, I saw a little bit of blood in the urine. That's nothing to, shrug off. It's just like if you see blood in the toilet after a bowel movement, that means you get a colonoscopy, you need it checked out.
Right.
When there's blood in the urine, always get it checked out. But the other thing is, a lot of times you don't see the blood,
Right.
and your doctor does a urine test, and they say, hey, we're finding a little bit of traces of blood here.
You have
That
microscopic hematuria.
Microscopic hematuria, that has to be checked out.
Okay.
I've seen it too, where people are embarrassed to get that checked out, like if blood in urine, and they delay it so long just because they're embarrassed to go to the doctor to get that checked. We're trying to normalize it so you're not embarrassed. If you have blood in your urine, just get it checked out right away. Don't be shy about that.
And most of the time, it is not cancer.
Right.
But it should be checked out.
There you go.
Right. A couple other questions. Does it alter your ability to urinate or your frequency? Or we talked about painless. Can you ever have pain? Can you have abdominal pain? Can you have pelvic pain? Can you have back pain?
It's very rare unless, this is showing up when it's already in an advanced form. So most of the time, it's going to be either just microscopic blood that your doctor finds. It'll be that you see a little bit of blood, or it's found incidentally. You go in for an ultrasound for whatever reason, and they say, oh, there's a little polyp in your bladder.
Okay.
Okay, so while we jumped in from risk factors to diagnosis, these are the symptoms that you might have and some of the signs and some of the investigations.
Right.
Anything else on that front, or can we move on to what am I going to do now that I have?
I think the number one way to diagnose it would be cystoscopy, would it not?
Yeah.
So you got blood in your urine, whether it's microscopic or gross, maybe you've had an ultrasound or not. The best way to diagnose is actually to look at it.
Yeah, it's just like the colon. You can't really do a good CT scan or ultrasound for colon cancer.
Okay.
Same with bladder cancer or checking for bladder cancer. You need to do a scope test called a cystoscopy. And that sounds like a horrible thing, but with recent advancements, we use fine little fiber optic scopes. It can still be uncomfortable.
No doubt.
But it takes literally 2 minutes to do it. And most people, when we're done, they say, why did I stay up all night worrying? This was a piece of cake.
Okay, piece of cake.
So then as the urologist, you're familiar with what a normal bladder looks like, obviously. You see something that's concerning. At the time of the initial cystoscopy, if you saw something abnormal, would you routinely biopsy that lesion?
No, once we see it, we need to come back on another time under an anesthetic.
Right.
And then we can do a biopsy or what we call a resection.
Okay.
Okay, so there's the diagnostic cystoscopy, which is a quick and easy piece of cake.
Which
as you
takes
call
2 minutes. Don't lose sleep over it.
Okay.
Yeah, and then if there is something there, we're going to come back with a slightly more invasive procedure.
Right, so this is when you're under an anesthetic of some type.
Thank God.
And then we look in with another scope, and we actually want to take not just a biopsy, but most of the time we can actually eliminate it. So when these present, most of the time it's what we call superficial on the surface, and it hasn't invaded at all, and it is curable. We can actually just take it out and remove it, and that's the cure. But we need to do a deeper biopsy. So think of the bladder as having layers. So there's a carpet, then you have the under padding,
Right.
and then you have the floor, the wooden floor. So the carpeting is where most of these tumors grow. They just grow on that carpet and they don't invade.
And so are those uroepithelial cells or transitional epithelial cells?
Yeah, that's what we call a transitional cells.
Okay.
So that's what we call superficial.
All right.
If we do that biopsy, we have to take all 3 levels
Right.
in that biopsy so we can see if the roots are going in.
Right.
Because that's critical for staging.
Right.
So if the roots are just in that carpet, it's superficial. And if the roots are going into that under padding, then it's still superficial but more worrisome. And if it's going into the muscle or that floorboard, then it's very serious because there's a lot of blood supply in the muscle.
Yeah.
And if cancer cells get into blood supply, that's not good news.
Right.
That's
it
how
gets,
cancer cells can spread, right?
Right.
Once they get access to your blood supply, then they spread, and that's called a metastases, and that's where you find a bladder tumor somewhere remote away from the bladder. So the real watershed area, is it involving the muscle? Is it not involving the muscle?
And then the second factor is also when they look under the microscope, do the cells look like they are slow growing type of cancer,
Right.
or really fast mutated type of cancer? So there's the stage and the grade.
Right. And that's how
A lot of details, but
No, but that's
it's important to know.
That's good. I think because that's a common thing amongst a lot of cancers.
Yeah.
We stage it and we grade it. Staging is how much it's involved, how deep it is, if it's spread. Grading is actually the type of cell, how aggressive it is, how much mitosis is going on, how much cell reproduction.
And I'd like to add in that most of the time when we find these, because people are presenting much earlier,
Yeah.
is that we find them at that superficial stage when they're just what we call polyps. They're still technically a type of cancer, but they are superficial and they can be cured by resecting it.
And that's the important thing, is if you have any of these, and that's why we're making this video, because if you can pick this up early, your outcome is so much better than if you let it slide for a long period of time and allow that cancer to grow into the muscle.
Exactly.
So would you say then, Pete, if it goes into the muscle, then the treatment, rather than just scraping it away, could be either partial removal of your bladder, or if it's through, you actually would perform a complete cystectomy where your entire bladder would be removed, and then the urine tract would be moved to another site?
That's right. So once it's into the muscle, that means it's invading into a potential blood supply, and then you need much more drastic treatment depending on, your age, your health, and most of the time it would mean removal of all of the bladder, and rarely, but sometimes just part of the bladder.
Okay. So in terms of treatment, we've got the majority are superficial cancers that are treated with a local excision and a biopsy to make sure it's not gone deep. If it has gone into the muscle, it's a bigger surgery where we actually remove part or entire bladder. Other than surgery, any other treatments that people might come across?
So the important thing to remember with bladder tumors is that it's a field change. So it's not like just a random growth in the bladder. The whole mucosa is at risk of subsequently developing this. It's like a weed in the garden. You pull one weed, but there could be little seeds that we can't see, so we have to do surveillance. So that means you have to come back for cystos, another cysto test every 3-4 months. Then if we don't see anything, we spread out to 6 months.
Just the easier one where you're taking the quick look.
The quick look.
Okay.
So we do surveillance.
Okay.
And then if there's recurrence, obviously, if we nip it in the bud, it can be done very quickly and easily.
Okay.
So this is quite common to recur, right? Bladder cancer, unfortunately, is one of those cancers that has a tendency to come back.
Yes, it is.
Yeah.
The other treatment, we can do things to prevent it from coming back by using different liquids that we put in the bladder. One of them is called BCG.
Right.
So you can have a treatment where you come in once a week, have a catheter put in the bladder, and then we put in a special liquid, and that can vary. Most commonly, it's a rare form. It's called BCG.
Okay.
And it stimulates your immune system
Yes.
to send all the killer cells to the bladder and attack anything that looks abnormal. So when your immune system comes to the bladder, it'll find any little cells that are starting to transition into abnormal and destroy them before they have a chance to grow.
Right.
So it's more of a preventative thing.
It's fascinating. It's a live attenuated infectious agent.
It's actually a form of tuberculosis.
Yeah, but attenuated. And so what it does is it just boost charges your local immune system to kill these cells. And actually, I think it does affect the cells themselves by encouraging apoptosis, which is what makes a cell die.
Apoptosis.
Nice.
He's been reading.
Yeah. It's good.
Isn't he an orthopod?
He is an orthopod.
Put that in your blender and make a smoothie out of it, boys.
There you go. Okay, so now you know kind of the A to Z for bladder cancer. If you have an experience with this, please share it. It actually is useful for other viewers. Leave a comment. And if you like this video, please like it, subscribe to our channel.
Remember, catching it early is key. So if you see that blood in your urine, don't be shy. Go get that checked out. Remember, you are in charge of your own health.
And thanks to Dr. Ince for joining us this morning.
You're welcome.
See you next time.